Welcome back to the WHN YouTube broadcast. My name is Ben Calderwood. We're really happy to have Dr. Eric Feigl-Ding back on the broadcast with us today to kind of reflect on a couple of things that have been happening this summer as pertains to COVID. I wanted to ask you, Eric, about your impression of how the recent Olympics in Paris dealt with the COVID pandemic, and also dealt with other sort of issues related to infection and so forth when we talk about, athletes participating in swims in the Seine River and so forth. Give us your take on how the organization handled this in terms of treating their athletes, and in terms of an Olympics that they had described as the first post-pandemic Olympics here in 2024.
Yeah, I think the Paris Olympics, while incredibly beautiful, was very, very different than the Olympics of the two previous ones in Tokyo and in Beijing. They had very strict testing. Tokyo was actually before most countries even got immunizations. And we know that obviously COVID is not exactly over. In fact, it's surging. There's a summer wave going throughout the world, not just the United States, but worldwide. And we know that a lot of these athletes will be bringing it back home to many other places of the world. We know at least 40 cases of COVID, and most famously, Noah Lyles collapsing after the 200 meters when he won the bronze medal. And of course, many people were upset about that. But I think it's just reflective of the IOC and the Paris organizers in general, because let's be honest, it was the blasé attitude that they have also applies to almost any other illness, including swimming in the Seine and getting E. coli. Now, only a few people were actually confirmed to have E. coli, but the IOC in Paris didn't want to confirm any other cases, and for other, obviously, publicity reasons. But we know that entire teams were either wiped out or kind of half decimated by the swimming in the Seine. So I think it's not just their attitude towards COVID, but just illnesses in general. And famously, the mayor Macron, of Paris, they said they'll swim in the Seine. The mayor actually backed out because with the samples of what is a safe E. coli level was sometimes 5 to 10x higher than what is normally generally regarded as safe levels. But yet the games must go on. So I think it's just reflective that sometimes, the commercial reasons have just completely swamped out, the considerations of infections. Now, is there going to be some crazy hospital surge directly? I'm not sure, because obviously many people are vaccinated, boosted, but this attitude in general will perpetuate these future variants that will emerge. And I think once we get unlucky, all we have to do is get unlucky with one really bad variant that emerges, and there are candidates out there, then we'll be in big trouble. And right now, vaccination rates are lower than ever for COVID, as well as for many other diseases. And I think this will only worsen and perpetuate that blasé attitude.
Speaking of blasé attitude, and sort of reflecting on that experience that you're describing of, people watching the Olympics and being aware of incidences of athletes falling ill and being unable to compete. Back here at home, as you noted, we are experiencing a fairly significant summer surge, and approximately simultaneously to that, the CDC has changed their designation of COVID. They are now describing it as an endemic condition rather than pandemic. I wanted to ask you first to describe what endemic means relative to viruses like this,
Right.
and give us your opinion on this latest CDC change.
Yeah, I think first of all, many people have a misunderstanding of endemic. Endemic means, it becomes a harmless virus in the background. No, that's not what endemic means. Endemic just means it has become almost like entrenched in an area that and sometimes entrenched in a very bad way. Because I always highlight, malaria is endemic to many parts of, say, Africa
Mhm.
and South Asia. And similarly, HIV is endemic in South Africa, which has about 20-25%, in some places, some pockets even higher, HIV prevalence. That's not saying that HIV is safe in any way just because it's endemic, nor is malaria safe in any way just because it's designated as endemic. It's just that it has become deep rooted and quite widely prevalent. And I think the CDC has not really said that, oh, we're reclassifying as endemic. But they just kind of like, just let us say we just reclassify it. But they don't highlight that it still means it could be dangerous, and it is, especially since we haven't solved long COVID and we have, new emerging variants that's gonna reinfect people, right? And I think people have not been told, for example, that malaria, HIV are also endemic. Just because they're endemic does not mean they're harmless, right? But right now, somehow we're letting that poorly defined word perpetuate. And many people have cited that, oh, CDC announces as endemic. It's now part of the norm. It
Mhm.
just we just need to ignore it and live with it. That's not what endemic means whatsoever. And this live with it attitude, we've already seen CDC have very blasé attitude with the isolation guidelines, where as long as you don't have a fever, 24 hours after your fevers are over, as long as everything else is improving, you don't have to you can just go out and you don't have to take much mitigation. You can just do one of several things, including test. But CDC actually doesn't even say you have to test negative. So what does that mean? Um, but I think this is where this downplaying, systematic downplaying, CDC has just in certain way been captivated by various potentially corporate interests that de-emphasizes actual public health, and putting public health in a back seat compared to many other priorities.
With that in mind, Dr. Eck Feigl-Ding, maybe at this point, having a better understanding of the true definition of endemic, and again, being in the middle of a fairly substantial summer surge here in 2024, maybe recap for our audience, best recommendations for how to care for themselves and others at this point in time in the middle of the surge.
Yeah. First of all, I think, if you are sick, if you have COVID, please stay home. Or at least at minimum, if you must go out, please wear an N95 mask if you must go out and you're sick. Um, get HEPA filters. Get more than one if you're in a large room, right? And open your windows. I think this ventilation, air cleaning is very, very important. And it doesn't just benefit COVID. By the way, there's other viruses. CDC just put out another virus alert for another respiratory virus. But, schools, they say teachers are at high risk, but I doubt teachers are going to hear that as schools reopen next week in many parts of the country.
Mhm.
I think there will be a booster for COVID in the fall. Probably it's going to come out late September, early October, be available early October. It's kind of like the same as, every September there will be a new Apple iPhone. Many people upgrade. I think people should upgrade their boosters to the new booster shots. Now, will it be perfect? No, not exactly, but it will provide much better coverage than the previous shot that you had last year, which again, the immunity wanes
Lanes.
and you have new variants. So I think everyone should be very careful, especially as school starts, especially school starting is always a nucleating a moment for lots of renewed household transmission. Um, and we should be vigilant that this thing is not over. And in many ways, just because it's endemic does not mean it should be ignored, just like we should not ignore HIV or malaria, even if they're endemic to certain places.
This is, as always, great advice, and I would say consistent advice. Just to sort of recap, we're talking about staying current with boosters, excuse me, especially since that virus continues to evolve and mutate. cleaning the air, wearing high quality masks, N95 masks if you are sick, and isolation. Um, all of the precautions that WHN and doctors like yourself have been advising us to take for years now. So um, thank you kindly for recapping that information. Thanks once again, of course, for joining us here on the WHN broadcast. Once again, we've been chatting with Dr. Eric Feigl-Ding. And a little bit about WHN. The World Health Network is a global organization that is devoted to ending the pandemic as a global health threat. If you'd like to learn more about our work, we encourage you to visit us online at whn.global. We hope you'll take a look and learn a little bit more about what we're about and consider joining us. Thanks again. We'll see you next time.